Test.com's MBLEx Practice Test. For complete practice, check out our 1,000-question, full-length practice exam for the MBLEx, written by massage therapy instructors who have worked in the industry for many years. Question 1. All muscles come in pairs, the agonist and the A. abductor, B. bipinnate, C. sarcomere, or D. antagonist. D. Antagonist is the correct answer. The antagonist works to counter the torque of the agonist, often used in slowing down a motion. Occurring in pairs, the agonist and the antagonist often balance each other. One contracts and the other relaxes. Abductor is a movement away from the midline. Bipinnate is a type of muscle fiber where two rows of opposite diagonal fibers come together at a single tendon, creating more strength but less shortening. Sarcomere is the smallest and most basic building block of a muscle fiber. Question 2. The long shaft of a bone is called A. epiphysis, B. endosteum, C. diaphysis, or D. periosteum. C. Diaphysis is the correct answer. Epiphysis is the end of a long bone. Endosteum is the thin layer of connective tissue, which makes up the medullary cavity. Periosteum is a sheath of connective tissue enveloping the bone except at articulation. Question number 3. Where bones meet to form a joint. A. ligament, B. emphysis, C. bursa, or D. articulation. D. Articulation is the correct answer. It is where two bones meet to form a joint. A ligament is connective tissue that attaches bone to bone. Emphysis is connective tissue between a ligament and bone or between a bone and a tendon. Bursa is the fluid-filled sac found between bones at the joint to counter friction. Question 4. A massage therapist presses and rolls muscles under her hands. What massage stroke is this? A. Tapotement, B. vibration, C. petrissage, or D. friction. C. Petrissage is the correct answer and is defined by massage techniques performed with the pads of the hands, including kneading, rolling, and wringing, in an effort to reach deeper layers of muscles. Tapotement, a rhythmic patting or striking percussion, is typically applied with the edge of the hand, loose fists, or hands in a relaxed cup position. Vibration can be manually applied with the hands, forearms, elbows, or an electronic massage device as a rigorous shake or a rocking of specific muscles or body segments. Friction, created by quickly rubbing the hands together while against the skin, can be used to create heat in order to help soften superficial layers of muscles. Question number 5. When standing still in front of a closed door and pushing on it without moving, the muscle action and/or tension is called A. isometric, B. isotonic, C. concentric, or D. eccentric. A. Isometric. In isometric exercise and contraction, the muscle length does not change, but the tension does. In an isotonic exercise, the muscle length changes, but the tension does not. A concentric contraction is the shortening of the muscle fiber, where an eccentric contraction is the lengthening of a muscle fiber. Question number 6. Myofascial pain syndrome is associated with which of the following? A. Muscle tenderness arising from a trigger point, B. Pain arising in the region of the face, C. Bone spur, or D. Reflux disease. A. Muscle tenderness arising from a trigger point is the correct answer. It can be caused by overuse, injury, or other stimulus which creates trigger points and referred pain. While pain can happen in facial muscles, MPS does not refer to the face in any way. Bone spurs can be painful as they are extra bony growths on the edges of bones. Reflux disease, or GERD, can present as a burning sensation in the chest, usually after eating or while lying down or inverting. Question number 7. The ability to guide the session, act as the authority, and maintain healthy boundaries and a therapeutic relationship is called what? A. Transference. B. Power differential. C. Professionalism. D. Countertransference. B. Power differential. The power differential in massage arises out of the authority a client grants to the massage therapist and the client's perception of the massage therapist as skilled in their profession. Professionalism is not the best answer in this question. Transference relates to when a client displaces feelings for another person on the therapist. Countertransference is when the displacement of feelings for another goes from the therapist to the client. Question number 8. The bones of the arms, legs, pelvis, and shoulders make up the appendicular skeleton. Is this true or false? True. The spine, ribs, and skull create the axial skeleton. Question number 9. During an assessment, a massage therapist asks a client to stand facing the right. What is the therapist assessing? A. Spinal curvature. B. Forward head carriage. C. Posture. Or D. All of the above. The answer is D. All of the above. The therapist is assessing the curvature of the spine, which may include forward head carriage and posture, to understand which muscles are working overtime and which are not working enough. The therapist will also look for any imbalances in the left and right sides to get an idea of the direction of the spinal curvature, especially if the client may have scoliosis. The observations may lead to a better understanding of the cause of any pain in particular muscle groups and much more. These observations may even give insight into how the client's lifestyle is affecting the shape of the body and help provide an intentional and therapeutic massage. Question number 10. When a bone turns on its own central axis, making a circular movement, it is called A. Circumduction. B. Gliding. C. Angular. Or D. Rotation. D. Rotation is the correct answer. Circumduction is a combination of abduction and adduction, as well as flexion and extension, a conical movement usually originating at a ball and socket joint. Gliding is a planar joint where two bones meet at a majorly flat articular surface, allowing bones to move along the joint's plane in any direction. Angular movements are defined by the fixed point from which they move, like a pendulum. Question 11. In the acronym used to notate interactions with clients, SOAP, or SOAP, what does the O represent? A. Objective. It is a notation of the client's range of motion and posture. B. Observation. It is a note on what the client feels in their body. C. Objective. It is what the massage therapist notices about the client. D. Onset. A notation of when the mechanism of injury occurred. C. Objective. The O in SOAP notes stands for the massage therapist's observation of how the client presents him or herself. Answer option A would fall under A for assessment in the SOAP notes. Answer option B describes what is subjective, the S in SOAP. Answer option D is part of the subjective component given by the client. Question 12. How does massage affect the immune system? A. Decreasing production of lymphocytes. B. Improves lymphatic flow and production of CD4 T cells. C. Decreasing leukocyte production and blocks T and B cell function. Or D. Increasing overall body temperature to mimic a fever. B. Improves lymphatic flow and production of CD4 T cells. Massage beneficially affects the immune system by improving lymphatic flow and the production of CD4 T cells, which help trigger the body's response to infection. A decrease in the production of lymphocytes does not happen. Rather, massage increases the transport of lymphocytes to increase excretion of bodily fluid waste. The decrease of leukocyte production is actually an effect of cortisol being released into the system. Finally, answer option D is incorrect. If anything, lying still during a relaxing, blood pressure lowering massage decreases body temperature. Question 13. All of the following are types of massage except A. Swedish, B. Deep tissue, C. Trigger point, or D. Kinesis. D. Kinesis. Kinesis is not a type of massage. Rather, it refers to non-directional stimulus-motivated movement or activity, usually in conjunction with another word part, i.e. photokinesis. Swedish massage employs long gliding strokes toward the heart to help circulation and bring overall relaxation to the body. Deep tissue massage is similar to Swedish massage, but focuses on the deeper layers of muscle and fascia, helping relieve chronic tensions, pains, and contractions. Trigger point focuses on points in sensitive taut muscle bands that are painful and may even refer pain by using isolated pressure to help melt and release the tension and introduce fresh blood flow and oxygen. Question 14. What is the meaning of the Greek root derm? A. Ligament, B. Bone, C. Skin, or D. Muscle? C. Skin is the correct answer. Ligament translates from Latin to bind, tie. Bone comes from Old English, bon. Muscle is a Middle French and/or Latin derivative, translating to muscle, sinew, and/or little mouse. Question 15. A client comes in with a sprain which occurred 3 or 4 days ago. How do you treat the area? A. Do not massage that limb of the body. B. Massage distal to encourage refreshed circulation and healing. C. Massage proximal to encourage refreshed circulation and healing. Or D. Massage the whole area gently, placing a little more pressure at injury site. C. Massage proximal to encourage refreshed circulation and healing. Massaging proximal to the sprain will encourage more efficient healing and any residual swelling to be handled by the lymphatic system. Answer option A is incorrect, as it is fine to massage the limb. Answer option D would likely irritate or re-inflame the injury, and B may encourage swelling below and around the injury. Question 16. What plane divides the body into front and back regions? A. Transverse or horizontal plane. B. Lateral or sagittal plane. C. Frontal or coronal plane. D. Mid-sagittal or median plane. C. Frontal is the correct answer. Transverse refers to the plane dividing the upper trunk from the lower body horizontally. Lateral plane or sagittal plane divides the body into left and right sides vertically. Mid-sagittal plane is just like the lateral or sagittal, only it specifies the direct center of the body as the division line. Question 17. Smooth muscle is also known as A. Skeletal muscle, B. Cardiac muscle, C. Visceral muscle, or D. Striated muscle. C. Visceral muscle is the correct answer. It is smooth muscle associated with the organs, especially those in the abdominal cavity. Skeletal muscle is a form of striated muscle. Cardiac muscle is only found in the heart and is its own classification. Striated muscle is composed of sarcomeres, which form contractile fibrils and then run parallel to one another in small groupings, creating muscle marked in dark and light bands. It includes skeletal, cardiac muscle, and most of our other muscles. Question 18. A massage therapist reminds a client of a former high school teacher who was stern with his students, thus making it difficult for the client to relax. What is occurring in this situation? A. Transference. B. Dual relationship. C. Transfeeling. Or D. Countertransference. A. Transference. This is a situation of transference where a client displaces feelings he or she has from someone from their past onto the therapist. A dual relationship describes a scenario where the massage therapist and that client have a relationship outside the context of the therapeutic relationship, which may mar or confuse the professional boundaries. Countertransference is the opposite of transference, where the massage therapist transfers feelings from their past to the client. Question 19. The main purpose of draping is A. To help protect the therapist from seeing the full exposure of the client's body. B. To keep the client's tissues warm, so they are easier to manipulate. C. To help the client feel comfortable and safe with professional boundaries. Or D. To help bring a safe work environment for the therapist. C. To help the client feel comfortable and safe with professional boundaries. A massage therapist's drape serves the purpose of maintaining professional boundaries to help the client feel comfortable and safe. While draping may serve to keep the client warm, this is not its primary purpose. Draping's main purpose is not to help protect the therapist. Question 20. Skeletal muscles normally work A. One at a time. B. In groups. C. Isometrically. Or D. Automatically. B. In groups. Muscles have to work in at least pairs as antagonists because they pull bone without pushing them. So, one muscle works to flex and the other to extend. Isometrically is one version of how we can use our muscles. This just means that we can use more or less pressure, but the distance will stay the same. An example is pushing on a locked door. While we have some muscles that move automatically, like our heart that moves without intention, our skeletal muscles are not among them generally. Question 21. All of the following guidelines should be applied to uphold a good standing professional massage and bodywork practice, except A. Dress conservatively, comfortably, and professionally. B. Keep diligent soap notes and documentation for each client. C. Keep a clean and safe space of practice. D. Do not show your sense of humor. D. Do not show your sense of humor. Showing your sense of humor is an important part of a healthy practice, as it helps humanize your practice. Question 22. Skeletal muscle is attached to bone by A. Ligaments. B. Epidermis. C. Joints. Or D. Tendons. D. Tendons. A tendon connects a muscle to a bone. It is typically a flexible but inelastic cord of strong collagen fiber tissue. Ligaments connect bone to bone. Epidermis refers to the skin. Joints are the articulating parts of our body, like the elbows and the knees. Question 23. While assessing a client, a massage therapist asks that they move their arm against a light applied resistance. What is this called? A. Passive range of motion. B. Active range of motion. C. Manual resistance range of motion. Or D. Active assisted range of motion. C. Manual resistance range of motion. In a manual resistance ROM assessment, a massage therapist applies light resistance to a client's movement. Passive ROM describes when the therapist moves the client's arm for them. In active ROM, the client moves her arm with no assistance from the therapist. Finally, during active assisted ROM, the therapist helps the client move their arm through their full ROM. Question 24. Which of the following are voluntary muscles? A. Skeletal muscle. B. cardiac muscle, C, visceral muscle, or D, spindle muscle? A, skeletal muscle is the correct answer, as voluntary refers to muscles that are generally under control of the individual's will. Cardiac muscle is what makes up the heart and is an involuntary muscle. Visceral describes the muscle type making up the intestines and most of the organs. Spindle fibers are actually proprioceptors in the bellies of the muscles. Question 25. If a massage therapist writes hyperkyphosis of the thoracic spine in his SOAP notes, what is he referring to? A, an exaggerated curve in the lower spine, B, a flat back, C, scoliosis, or D, an exaggerated curve of the upper back? D, an exaggerated curve of the upper back. Hyperkyphosis is present when the thoracic spine has an excessive forward curve. A person with hyperkyphosis will have rounded shoulders with the head and neck forward of the trunk. Answer option A describes lordosis. Flat back means the back has little to no natural curve of the spine, and scoliosis creates more of a lateral S shape of the spine. Test.com's MBLEx Practice Test. For complete practice, check out our 1,000-question, full-length practice exam for the MBLEx, written by massage therapy instructors who have worked in the industry for many years. Question number 26. Which of the following is not a type of Oriental massage therapy? A, Tai Chi Chuan, B, Jin Shin So, C, Shiatsu, or D, Ama? A, Tai Chi Chuan. Tai Chi Chuan refers to a type of Chinese martial art. Jin Shin Do is a type of therapeutic acupressure. Shiatsu is a Japanese style of body work using finger pressure on specific points and lines of the body in order to restore energy flow. Ama is a type of Chinese massage and is where Shiatsu came from. Question 27. All of the following are bone density and connective tissue disorders which require a doctor's approval to proceed with massage, except this disorder, for which clearance cannot be given while the disorder is still present. A, osteogenesis imperfecta, B, osteoporosis, C, osteopenia, D, osteomyelitis. D, osteomyelitis. Osteomyelitis is an infection of the bone tissues and marrow caused by staph or strep resulting from a compromised bone from injury or surgery. Massage is not contraindicated, and a doctor's clearance cannot be given for massage while the infection is still present. For the other answer options, a doctor's clearance for massage is required. However, a deep or high-pressure massage would be contraindicated even with a doctor's clearance. Osteogenesis imperfecta is a defective development of connective tissue where the bones become fragile. Osteopenia is lowered bone density and often the precursor to osteoporosis, which is a loss of bone tissue causing fragile or porous bones. Question 28. The hypodermis is directly below what layer of skin? A, epidermis, B, dermis, C, stratum corneum, or D, stratum germinativum? B, dermis is the correct answer. The order from superficial to deep goes stratum corneum, mostly dead, non-nucleated skin, epidermis, dermis, hypodermis, and stratum germinativum, the fifth layer and the basal layer. Question 29. All of the following are serious contraindications for massage, except A, systemic or contagious and/or infectious diseases, B, frostbite, C, acute flare-up of rheumatoid arthritis, D, borborygmus, D, Borborygmus is the sound of a rumbling tummy, so it is not contraindicated for massage. Answer option A is incorrect because a massage therapist does not want to spread, exacerbate, or contract the disease, even if it is a common cold. Massaging frostbitten areas can cause more or worsen tissue damage. Also, a therapist does not want to create more inflammation and/or pain by massage areas with acute flare-ups of rheumatoid arthritis. Question 30. Where is the liver located? A. Right lower abdomen. B. Left lower abdomen. C. Right upper abdomen. D. Left upper abdomen. C. The upper right abdomen. The lower right abdomen holds the ascending colon and small intestines. The lower left abdomen is the location of the large and small intestines. The upper left abdomen carries the gallbladder, pancreas, and many other small but important parts. Question 31. Which of the following is not an effect of massage on the nervous system? A. Reduce proprioceptive response. B. Enhance body awareness. C. Trigger parasympathetic nervous system. D. Pain reduction. A. Reduce proprioceptive response. Massage actually increases or heightens proprioceptive response. The other answer options are benefits of massage. Question 32. With an arm pinned to the side of the body at a 90-degree angle and the palm facing up, what is the movement of the forearm that rotates the palm to face downward? A. Flexion. B. Abduction. C. Pronation. D. Supination. C. Pronation is the correct answer. Abduction would occur if she lifted her arm straight up. Supination would be returning the hand where it was, palm facing upward. Question 33. Which of the following techniques should be avoided when massaging appendages presenting with signs of overuse, such as varicose veins, swelling, or other warnings of poor circulation? A. Deep effleurage proximal to distal, medial to lateral. B. Petrissage to mimic the contractions used in exercise. C. Toward the heart, where strokes move in the direction of the venous return. D. Deep effleurage distal to proximal, lateral to medial. A. Deep effleurage proximal to distal, medial to lateral. Using deep effleurage proximal to distal or medial to lateral could create excess pressure on the veins and prove troublesome if there are varicose veins or any sort of swelling or circulatory issues. On the other hand, deep effleurage distal to proximal, lateral to medial will encourage ease on the veins and healthy blood circulation. Petrissage helps oxygenate and move blood toward larger veins. By using strokes in the direction of venous return, the therapist eases blood toward the heart and ultimately creates easier oxygenation for the whole body. Question 34. What plane divides the body into upper and lower regions? A. Transverse, horizontal plane. B. Lateral, sagittal plane. C. Frontal, coronal plane. D. Mid-sagittal, median plane. A. Transverse horizontal is the correct answer. The lateral or sagittal plane divides the body into two sides vertically. The frontal coronal plane divides the body into front and back halves. The mid-sagittal or median plane is a vertical division along the midline with two equal sides. Question 35. In the event that the initial intake process reveals a pathology or injury that a massage therapist is not trained to work with, like pregnancy, COPD, TBI, severe autism, what is the appropriate way to proceed? A. The massage therapist should go ahead with the treatment. It will be good practice for new techniques. B. The massage therapist should refer the client to an LMT with the education and training to safely work with the client. C. The client should decide whether or not to proceed with the treatment. D. the appointment should be canceled without massage therapist involvement. B. The massage therapist should refer the client to an LMT with the education and training to safely work with the client. The best way to move forward is to refer the client to an LMT with the appropriate training and education. It is unethical to use the client to practice techniques the therapist is not qualified to perform. A client cannot consent for a massage therapist to perform techniques for which they are not qualified. The massage therapist should make a referral if possible. Question 36. What connective tissue ensheathes the entire muscle? A. Endomysium. B. Fascia. C. Epimysium. D. Muscle fiber. C. Epimysium is the correct answer, literally meaning on or above the muscle. It creates a fibrous envelope which surrounds each skeletal muscle, protecting them from friction. Endomysium literally means within the muscle. It ensheathes each myocyte, capillary, and nerve. Fascia surrounds, stabilizes, and separates muscles and organs. Muscle fiber is a building block of the muscle, often cylindrical, containing more than one nucleus, and made of many myofibrils, which respond to stimulation by contracting. Question 37. If a client and a massage therapist desire to engage in an intimate sexual relationship, what is the common waiting period after the termination of the therapist-client relationship? A. 30 days. B. 60 days. C. 4 months. D. 6 months. D. 6 months. According to American Massage Therapy Association and Tappan's Handbook of Massage Therapy, a 6-month wait period is common across the country after the termination of the therapist-client relationship. Question 38. Which of the following is positively affected by regular massage? A. Posture, attitude, and flexibility. B. Inflammation, breathing, and appetite. C. Immunity, mental clarity, and weight loss. D. All of the above. D. All of the above. Massage offers all of the benefits listed in the answer options. Question 39. Blood vessels, hair follicles, nerve receptors, and skin glands are located in the A. Epidermis, B. Subcutis, C. Dermis, D. Stratum corneum. C. Dermis. The dermis is between the epidermis and the subcutaneous layers of skin, consisting of irregular dense connective tissue to cushion the body, but also nerve receptors, hair follicles, sweat glands, and the like. The epidermis is the most superficial layer of the skin. The subcutis layer is the deepest layer of our integumentary system, consisting mostly of fatty cells. The stratum corneum is the outermost layer of skin and is made up majorly of dead and flattened cells. Question 40. The axial skeleton contains the skull, vertebral column, and rib cage. Is this true or false? True. The bones of the head and trunk make up the axial skeleton. Question 41. When a part of the body is toward the side, away from the midline, it is referred to as A. Rostral, B. Caudal, C. Lateral, D. Dorsal. C. Lateral is the correct answer. The further from the midline toward the side body, the more lateral. Rostral is toward the front of the body, in particular toward the nose and mouth. Caudal refers to a body part which is both inferior and posterior, or toward the tail. Dorsal refers to the back body. Question 42. Which of the following are not accepted goals of massage? A. Medically treat physical defects. B. Ease symptoms of tension and fatigue. C. Ease symptoms of injury or disease. D. Relieve pain. A. Medically treat physical defects. Medical treatment is not within a massage therapist's scope of practice. The other answers are goals of massage. Question 43. The ends of a long bone are called A. Epiphysis, B. Endosteum, C. Diaphysis, D. Periosteum. A. Epiphysis is the correct answer. Usually growing separate from the shaft at the start, the epiphysis makes up the ends of the long bones. Endosteum is the thin layer of connective tissue which makes up the medullary cavity. Diaphysis is the shaft of the long bone. Periosteum is a sheath of connective tissue enveloping the bone except at articulation. Question 44. A client's SOAP notes state that the client presented with pediculosis in their last visit. What condition did they have? A. Bad breath, B. Lice, C. Athlete's foot, D. Impaired vision. B. Lice is the correct answer. Bad breath would be called halitosis. Athlete's foot is otherwise called tinea pedis. Question 45. What bones are found in locations where a tendon passes over a joint, such as the hand, knee, and foot? A. Short bones, B. Flat bones, C. Sesamoid bones, D. Irregular bones. C. Sesamoid is the correct answer. These bones develop inside the tendon, are typically at the joint surface, and are generally thought to serve as pressure and friction modifiers. Short bones are typically as wide as they are long, usually providing little movement but lots of stability. Flat bones are generally flat and broad, providing protection and more space for the muscle attachment, as in the skull and pelvis. Irregular bones are the bones whose shape serve a very specific purpose, so cannot be grouped in the aforementioned long, short, flat, or sesamoid. Examples would include the lower jaw bone, mandible, and the sacrum. Question 46. A client presents with diagnosed carpal tunnel syndrome. Should this be addressed by a massage therapist? If so, how? A. Yes, with applied pressure directly to the wrist, as with trigger point therapy. B. No. The only functional treatment for CTS is surgery. C. Yes, by both breaking down scar tissue in the wrist and massaging all involved muscles. D. No. Encourage nonsteroidal anti-inflammatory drugs, or NSAIDs, and avoid the affected arm completely. C. Yes, by both breaking down scar tissue in the wrist and massaging all involved muscles. Massage can help restore full ROM as well as alleviate increased stress on the wrist. The massage therapist should encourage the client to take breaks from heavy wrist work to avoid overuse flare-ups. Answer option A is incorrect, as it may irritate the already inflamed ligaments. Answer option B is incorrect. While surgery is an option, it is far from the only option. Finally, there is no reason to avoid the arm, though NSAIDs may help alleviate pain temporarily. Question 47. The movement of the sole toward the median plane. A. Angular movement, B. Inversion, C. Rotation, D. Abduction. B. Inversion is the correct answer, as the sole would have to reverse its normal position to move toward the midline. Angular movement is any movement which changes the angle of the bones at the joint. Rotation is a pivotal movement, a revolving around a single axis. Abduction is a movement away from the midline. Question 48. A client has been diagnosed with cataplexy. What condition do they have? A. Brittle bones, B. Momentary fits of rage, C. Sleepwalking, D. Temporary muscle weakness. D. temporary muscle weakness is the correct answer. It is usually a weakness triggered by the sudden expression of emotion like laughter. Brittle bones may be just that, osteogenesis imperfecta, or could refer to osteoporosis or osteopenia. Momentary fits of rage may be due to depression, intermittent explosive disorder, or just uncontrolled anger. Sleepwalking can be called somnambulism and describes activity or walking during sleep. Question 49. One of the main focuses of Oriental massage therapy is restoring a proper flow and balance to the energy in the body. Is this true or false? True. This statement is true. Restoring the proper balance and flow to the energy of the body is one of the main focuses of Oriental massage therapy. Question 50. If a client says something during a session that a therapist thinks is a sexual pass, what should the therapist do? A. Pause the session, maintain professional boundaries, and clarify the purpose of the session. B. Immediately terminate the session. C. Respond in an uncomfortable but kind manner and hope it stops. D. Pretend it did not happen and continue the massage. A. Pause the session, maintain professional boundaries, and clarify the purpose of the session. It is best to pause the session and remind the client of professional boundaries and find clarity surrounding the purpose of the session. Make sure the client is on the same page before proceeding. Immediately terminating the session may be required depending on the situation, but is not necessarily the suggested first response. The massage therapist should not respond vaguely and hope that it does not happen again or ignore it. Thanks for watching Test.com's MBLEx Practice Test. For complete practice, check out our 1,000-question, full-length practice exam for the MBLEx, written by massage therapy instructors who have worked in the industry for many years.